So, very good evening to everyone. I hope I am clearly audible and visible. I welcome you all to the session. So, this is the part 2 of your FMGE revision session. I welcome you all to the session. So, this is the part. So, those who are new to the platform, what all you get with Unacademy Plus subscription is daily live classes of all your 19 subjects. The classes and the sessions, all the live sessions are prior streamlined and structured. Then you get live tests along with your subscription and unlimited access to all the courses, whether live or recorded, for the duration of your subscription. Then you can go with your iconic subscription too, where you get the best of Unacademy and the recorded versions of Prep Ladder in the form of live classes of Unacademy, where batch courses are there targeting different exams. Then this is a test series which is available every day at 8 p.m. and 9 p.m. targeting different exams. Coming to free live classes for this month, I have already completed all my free live classes. So where you can avail those free classes, they are available as recordings. If you go to my profile, in my profile you will see this special classes section. Okay, special session or special class. And December month sessions I will be updating on the Telegram group. Now, how to download the Unacademy Learning app? Just search this Unacademy Learning app, open and install it, go for NEET PG segment. There you will come across this plus, Unacademy NEET PG plus. If you open this, when you are going to subscribe for the courses, you will get option whether you want to go with plus or iconic. So depending on your need, you can go ahead with your choice. And then you can apply this referral code to get a discount at your subscription, and the duration can be decided by you depending on your need. So now coming to the session, welcome you all. So moving ahead from part 1, in part 2 I will be discussing those chapters which were not covered in part 1 with the help of certain MCQs. So this is the first one. Good evening everyone. The post-mortem finding seen in smothering, which one will be the correct option out of ABCD? The post-mortem finding seen in smothering. Yes, the best answer to go with is option A. What is smothering? Smothering is obstruction of, external obstruction of your mouth and nose by any means, by hands or by pillow or by anything. So when there is pressure over mouth and nose, what happens is you can get bruises or abrasions over inner side of lips and over frontal aspect also, but mainly seen over inner side, that is your mucosal side of lips, both lips. A very important post-mortem finding for your cases to be determined as smothering cases. Answer this one. A person employed without medical qualification in medical field. What do you call this? If you have to pick the best answer out of ABCD. A person employed without medical qualification in medical field. All of you know this. All of you know this, I think. So yes, correct answer here goes with covering. What do you mean by covering? This is also defined as association with unqualified person. If a doctor is covering a unqualified person, he is doing a unethical act called as covering. Then adultery previously was a punishable offense under 497 IPC, but by our honorable Supreme Court it is clearly mentioned that it is not a offense in law anymore, but for we doctors adultery is still unethical. So it was offense earlier under 497 IPC. Then what do you mean by dichotomy? Dichotomy means fee splitting between doctors by unwanted referrals. Doctors like a physician and a surgeon, they are sharing the OPD fees of a patient by referring the patient just like that. So they are performing a unethical activity. Next one. All of the following may cause traumatic asphyxia except. Today you will find all the MCQs to be newly framed. MCQs are framed so that you mark the answer wrong. If you have not revised, you will mark the answer wrong. That is the purpose of framing the MCQs. So they basically test how much you have revised a topic. All of the following may cause traumatic asphyxia except. The best answer of choice will be accidental strangulation. Why? Because yes, in railway accident, stampede can occur that can cause traumatic asphyxia. What is traumatic asphyxia? External compression of the chest by a heavy object. External compression of chest by a heavy object or by anything which is very heavy. So what will be the appearance when this person comes for autopsy and he has died due to traumatic asphyxia? Suppose the dead body is lying over the autopsy table. What I will see is, I will see a lower demarcation line over the lower part of the chest, and above this demarcation line everything will be reddened and congested. So this unique facial, neck and chest appearance with a lower demarcation line, what is this called? In one word, what is this called? Anyone? Yes, I have. Yes, Amar, correct. This is called as mask ecchymotic. Mask ecchymotic. So yes, it can occur in railway accidents. It can occur in any RTA case also. It can occur in stampede cases. But accidental strangulation is compression of the neck. It is not compression of the chest. How can accidental strangulation take place? Suppose a female going on a rickshaw. Okay. Suppose a female was sitting on the rickshaw and she was wearing salwar, chunni and everything. Now this chunni somehow got entangled with the wheel of the rickshaw. So now this chunni can strangulate the female. So yes, this will be a case of accidental strangulation. Okay. It is not traumatic asphyxia. It is compression of the neck. Got it? Next one. Simple one. आज का सबसे सिंपल सवाल, बस सही आंसर करना है. आंसर इज इन फ्रंट ऑफ योर स्क्रीन. You just need to pick it up. बी सी चल रहा है, ठीक है. Some are going with option B, some are going with option C. Let us see. So brownish black color of contusion is due to hemosiderin. Hemosiderin. What are the color changes of a contusion or bruise? Initially the contusion is red in color when the injury is less than 3 hours old due to presence of oxyhemoglobin pigment in the bruised area. Then the color becomes blue between 3 hours to 3 days due to deoxyhemoglobin. Here comes deoxyhemoglobin. This gives rise to bluish color to the bruised area. Then the color becomes blue black, or we can say dark brown also. Okay, so the color was brownish black. So yes, blue black, or you can say brown color, occurs on about 4th day of the injury due to formation of hemosiderin pigment in the bruised area. Now after this the color becomes green or between 5 to 6 days of the injury due to formation of biliverdin pigment in the bruised area, and between 7 to 12 days the color becomes yellow due to formation of bilirubin pigment. So you should remember the name of the pigments which give rise to color changes in the bruised area. Okay, so we have revised this topic. I know this is a volatile area, you tend to forget it. Next one. What is professional death sentence? Pick the best one. What is professional death sentence? This one is a simple one. Yes. Professional death sentence is penal erasure of a doctor's name from state medical register, to be exact. From the state medical register is called professional death sentence. Now, this erasure can be temporary also. It can be permanent also. Which one is referred to as professional death sentence? Temporary penal erasure or permanent penal erasure? Suppose the options are professional death sentences, temporary penal erasure and permanent penal erasure. Which one you will pick? Yes, permanent penal erasure is basically your professional death sentence. Next one. Scalp laceration may resemble which of the following injuries? Scalp laceration may resemble. These are pretty simple questions, but if you know the theory part, then only you can solve. Which one option can be easily ruled out? See, the type of injury is already mentioned, that the injury is laceration. So which options can be easily ruled out? Yes, it cannot be abrasion, it cannot be contusion. Simple. Because the injury type is already mentioned. So now you are left with two options. Suppose you don't know anything. You just know that abrasions, contusions and lacerations are blunt injuries. So if laceration is mentioned, it cannot be abrasion or contusion. All these are blunt injuries. So scalp laceration usually resemble incised wounds. What is this called? Incised looking lacerated wound. Incised looking lacerated wound. Seen over which body areas? Wherever bone is just beneath your skin, like scalp, then your forehead also, scalp and forehead, then your shin area, anterior tibial area, then your iliac crest also. Iliac crest also, the bone lies just beneath the skin. So these are the most common areas where even lacerated wound will appear to be incised. But if you watch it closely, you will appreciate that yes, the margins are irregular, and you can get tissue bridges also between the two margins. So you will make out yes, the injury is a lacerated wound. Got it? So two options can be easily ruled out. Suppose you don't know anything, this is how you should approach such questions. Next one. Most common organ affected in penetrating injury to abdomen. A straight one-liner question. Penetrating injury. The question is most common organ injured in penetrating injury. So the correct answer of choice is, many are answering wrongly. So please correct it. Most common organ injured in penetrating injury to abdomen is liver. Then the most common organ affected in blunt trauma. If the question is blunt trauma, out of ABCD, what will be your correct answer? Most common organ affected in blunt trauma overall is, here comes spleen as the answer. Mesentery will be the answer to which question? Mesentery rupture or rupture of mesenteric vessels is most commonly seen due to effect of seat belt. So most common organ injured due to seat belt injury. Here your answer goes with mesenteries. In which of the deaths mesenteric fats are usually preserved during autopsy? In which deaths you will preserve mesenteric fats? Then intact lungs also. Intact lungs is a better answer. In which type of deaths intact lungs and mesenteric fats are preserved during autopsy? Always remember, intact lungs along with mesenteric fat, they are very good samples for any case of anesthetic deaths. Yes, very good, Deepesh Karki, very good. Anesthetic deaths, because inhalational anesthetic agents, they have a tendency to get concentrated in mesenteric fats, and yes, they will be found, they can be quantified from your intact lungs, from the airways. So remember this. Now most common brain injury in blunt trauma. Most common brain injury in blunt trauma. Answer. Which type of injuries are most commonly seen in head or brain? I have written the exact thing, brain injury. नहीं, most common brain injury, answer will go with cerebral contusions. Cerebral contusions or cerebral bruise are most commonly seen in blunt impact injuries to brain. Now if I ask you most common brain hemorrhage in blunt trauma, now your answer goes with subarachnoid hemorrhage, SH. Subarachnoid hemorrhage. Okay. Why everyone is answering EDH? EDH is the least common type of intracranial hemorrhage. Least common type. Okay. So please correct it. Most common brain injury overall is cerebral contusions. Most common brain hemorrhage. Here the word is hemorrhage. It will be SH. Okay. Then other most commons. Most common organ injured in bomb blast cases. Due to bomb blast explosion, which is the organ which is most commonly damaged? Answer goes with yes, tympanic membrane, preferred over lungs as the answer of choice. Now most common vertebral injury in blunt impact. Most common vertebra to be injured overall. Most common vertebra to be injured. Remember this, C5 to C6, because they are hypermobile. So due to their hypermobility, hyperflexion injuries are most commonly seen in C5, C6 vertebral regions. Yes, cervical vertebra. When will the answer come to thoracic spine? If they ask you most common injury in aviation injury, most common organ injured, most common organ injury in aviation accidents. Aviation means airline accidents, aircraft accidents. So here your answer will go with fracture of thoracic spine. Okay. So all the most commons are at one place. Next question. Read the lines carefully. बताओ आंसर बताओ. I have already told, read the lines carefully. अमर खांडे एक बार और पढ़ो, फिर से पढ़ो क्वेश्चंस की लाइन. If death of a patient occurs during surgery due to negligence of the surgeon, then he can be charged under. He can be charged under, yes, 304A IPC. What is 304A? Negligent act leading to death of a person. So here the doctor was negligent, and as a result his negligence led to death of the person. So the doctor will be held responsible under 304A IPC itself. Now also remember, in general, which cases are registered under 3 in the FIR under 304A? Your road traffic accidents. If someone is killed due to road traffic accident mechanism, our Indian law says the case will be registered in the FIR under 304A. What is the maximum punishment? 2 years imprisonment or fine. So see the wide discrepancy in Indian laws. If someone is killed by road traffic accident mechanism, suppose purposely also, then also the FIR goes with 304A instead of murder charges. 304B is for dowry death. What do you mean by dowry death? Death of a married female within 7 years of marriage under suspicious circumstances, and if it is proved that just before death the female was subjected for dowry either by husband or any relative of the husband. So those people who are involved in that dowry demand just before death, all those will be the accused in the FIR registered under 304B IPC, which defines dowry death. Now, investigation of dowry death will be under which section? IPC or CRPC? Investigation of a dowry death will be done by whom and under which section? The FIR has been registered under 304B. The inquest will be done by whom? Police or magistrate? Answer goes with, it is a very common case of magisterial inquest, which comes under 176 CRPC. So read the lines of the question. Suppose this question comes, a dowry death case will be investigated. So investigation is a procedure done after a crime has occurred. So all the procedures are mentioned under CRPC sections, correct? But if they ask you dowry death case will be registered under, so it will be registered under IPC sections, and that too under 304 BIPC. Okay, someone is asking Amar Khande 498A. See, 498A deals with cruelty by husband or relative of the husband. Suppose the female has not died. Your question is very genuine question. Suppose the female has not committed suicide. She goes to a police station and tells the policeman that she is facing cruelty for dowry demand by my husband. So now the police will register the case in the FIR under 498A. Now this cruelty can be anything. It can be sexual cruelty. It can be economical cruelty. It can be physical cruelty. Many types of cruelties are covered under 498A itself. Then we have an act also in our Indian laws, Domestic Violence Act, particularly made to cater these cases, where a married female is facing either sexual, economical, physical, mental types of cruelties. So Domestic Violence Act is also there, and your FIR can be registered under 498 AIPC. Got it, Amar? Amar Khande. चलो अब आते हैं इस क्वेश्चन पे. Answer this. Stellate wound is produced with firearm in. Stellate wound. Simple question. Stellate wound. Also called as star-shaped wound. Also called as cruciate shape. So synonyms of stellate is star-shaped or cruciate. So this is produced in contact shot. Yes. Because see, when the muzzle end of the gun is in contact with the skin surface, whatever is coming out from the barrel, like suppose the weapon is a rifled weapon, bullet will come out. Now along with bullet, flame, smoke and unburnt gunpowder particles, unburnt primer particles, everything will come out, and they can create a local explosion here, because just beneath the skin what is present is the skull bone. So usually such stellate wounds are seen wherever bone is just beneath the skin, so there will be a local explosion in the skin and soft tissues, so you will get a wound like this called as stellate, star or cruciate shape. Okay, now there is one more term which should be clear, a term called back spatter phenomena. Now what is back spatter? Suctioning of skin and soft tissues inside the muzzle end of the barrel of a gun. So in contact shot, what you can get in extra inside the weapon, suctioning of skin and soft tissues can occur. Which principle inside the barrel of a gun? Which principle says so? Whenever two things come into contact, there will be exchange of matter. Like if the weapon has come into contact with the skin, what is this weapon getting? Skin and soft tissues can be suctioned due to a negative pressure inside the barrel. The phenomena is called back spatter. Which principle says so? Whenever two things come into contact, there will be exchange of matter. So this back spatter phenomena signifies your Locard's principle of exchange itself. Locard's principle of exchange. A very good example of Locard's principle of exchange. Whenever two things come into contact, there will be exchange of matter. Your whole trace evidence chapter, red stain analysis and white stain analysis chapter is based on Locard's principle of exchange. This back spatter phenomena is mainly seen with which weapons? So mainly with shotguns. This is mainly with shotguns. Answer this one. 7-year imprisonment verdict can be given by which of the following judges? 7-year imprisonment verdict can be given by Deepesh, Tanya, Dr. Physician, Amar Khande, Shreya Thakur, Anjum Fatima. All of you do combined study, I think. All of you have answered D as the answer of choice. Why D will be the answer of choice? 7-year imprisonment verdict. So let us quickly revise this topic, then I will tell you the correct answer. I know this is a volatile topic again. Power of judges or power of courts. I can say power of courts or power of judges because judge is the supreme authority in the courtroom. So at the lowest level we have Judicial Magistrate Court, JM courts, where the hierarchy starts like this: second class, first class, then comes Chief Judicial Magistrate. Correct? Then comes Chief Judicial Magistrate. Now this first class judicial magistrate in metro cities is called Metropolitan Magistrate. In juvenile courts, this is the magistrate. First class judicial magistrate is the level which presides over a juvenile courts, and there he is called Principal Magistrate or PM. Similarly, Chief Judicial Magistrate in metro cities is referred to as Chief Metropolitan Magistrate, CMM. So these are your 3 levels of judges starting from bottom to top. Bottom one is second class, top one is CJM. Now the judges have got 2 important powers: power of imprisonment and power of fine. Imprisonment is like this: 137. Always remember 137 number. Power of fine is 5,000 rupees for your second class, 10,000 rupees maximum fine power is of first class, and CJM has got unlimited. So remember it like this, and you will never mix and match. Okay. So judicial magistrates are of 3 levels, bottom to top: second class, first class, CJM. 137, 5,000, 10,000 unlimited. Above this comes your sessions court, which are highest court at your district level, and here also there is a hierarchy to be followed, like assistant session is the lowest level of courts at sessions level, assistant session. Then comes your additional session, and then comes your district judge, DJ. Now here the imprisonment power is 10 years for maximum for assistant session. What is the unique power of additional session? This additional session just says people have given me many D alphabets. So I will have this unique power of death sentencing or life imprisonment to be given to the accused. So the question is, which is the minimum rank of judge who has got death sentencing power? Answer is additional. It cannot be assistant. This is the most common wrong answer because of lack of revision. So this will help you to minimize your silly mistake. Additional has got D alphabet, D for death sentencing. So yes, if additional is having death sentencing or life imprisonment power, all the judges above this level will have the power. And similarly, unlimited fine power starts with CJM. So all the judges will have this unlimited fine power. So these two become important questions and you should remember the power of judges like this. Above sessions level courts will be your high courts and supreme courts. Now one more thing to be remembered. Whenever death sentencing is given at sessions level, either by additional or by district judge, the file is sent to a high court judge for confirmation. So death sentencing is confirmed by a high court judge. And if he agrees, then death sentencing is awarded to the accused. Got it? Chalo, आगे बढ़ते हैं. Now, what will be the best answer? Now, what will be the best answer? 7-year imprisonment verdict can be given by 137. Yes, A will be the correct answer. So remember the CJM is itself called Chief Metropolitan Magistrate in metros. First class judicial magistrate is called Metropolitan Magistrate in metros. And he is also called Principal Magistrate in juvenile courts. 10-year imprisonment verdict can be given by, suppose I change the question, instead of 7 I write 10. Now the answer will become 10-year imprisonment verdict can be given by. Now your answer will come to, yes, option C will now be the best answer if 10 year is in the question. So questions do come from this area. Not to, this topic should not be left. So revise it. We have covered it fully. Next one. Following are features of gunshot wound except. Following are features of gunshot wound except. Let us start from option D. Stellate wound is seen in contact shot. Yes, this is a true statement. Harrison Gilroy is one of the tests for gunshot residue detection. This is also a true statement. Abrasion collar can be seen in entry wound, in rifled entry wounds. So yes, A will be the answer of choice because this is a wrong statement. Now what is beveling? Beveling is chipping off a part of the skull table. So if this is your skull table, it has got two tables. Skull bone has got two tables, outer and inner. Now suppose a bullet is coming from this direction. This is the entry wound area. What is the movement direction? Movement direction is this. Now in the direction of movement of the bullet, outer table says I have the support of inner table. So it is very happy. But the inner table cries and says this bullet is going to take away a part of me. What do you call this scientifically? Beveling, chipping off a part of the skull table. So which table is showing you beveling? The unsupported table with respect to entry wound. Which is the unsupported table? The inner table. So remember this line, unsupported table of the skull bone shows beveling. Similarly, when the bullet is coming out, what is the direction of motion of the bullet? Like this. Now in the same direction, inner table now has the support of outer table. Now outer table remains unsupported. So now beveling will be seen over outer table because unsupported table shows beveling. So yes, this beveling over outer table is suggestive of exit wound. Got it? चलो अगला मैकनॉटन्स रूल है. ये मजा आएगा आपको. सॉल्व करो. पिक द करेक्ट आंसर. मैकनॉटन्स रूल is. This question has been asked 3 times in FMG exams. McNaughton's rule is. Everyone is answering correctly. Correct. So the correct answer of choice will be D. Nothing is written, but yes, this one will be the best answer of choice. Ideally there should be 84 IPC, but I did not write IPC here. So McNaughton's rule is 84 IPC. McNaughton's rule was formulated in which year? In which year the judgment of McNaughton's case came? When was this rule formulated? Basically, that is the question. Answer. So this was formulated in 1843. Now, if I ask you, Section 84 IPC was formulated in which year? Now, what will be your answer? 1843 or something else? Section 84 IPC was formulated in which year? Now your answer of choice will become 1860. All our IPC sections were formulated by Britishers in 1860, and since then we are following the IPC sections. Next one. Pelvis alone helps in. What is the accuracy of sexual determination from pelvis bone? That is the simple question. Accuracy of pelvis for sexual determination is how much? So the accuracy is, yes, all of you are correct, 95%. Let us quickly revise. If you have all 206 bones, your accuracy comes out to be 100% for sexual determination. If you have pelvis and skull, your accuracy decreases little bit to 98. If you have only pelvis, that was the question, your accuracy comes out to be 95. If you have only skull bone, your accuracy decreases to 90. If you have only long bones, now your accuracy decreases to 80%. This accuracy table was given by which fellow? Who gave us this formula or table for sexual accuracy? The name of the person is Krogman's. This is called as Krogman's table or Krogman's formula for accuracy of sexual determination of skeletal remains. Next one. Last question for today. Xiphoid process fuses with sternum after how much age? So xiphoid process fuses with a sternum after half a minute more, and we will discuss this. Sternum bone, its appearance, age of appearance, and age of fusion of different centers. Xiphoid process fuses with the sternum after. The best answer of choice will be option B. So let us quickly revise this topic. This is your sternum bone. Okay. It has got three parts: manubrium, then you have body, and then you have xiphoid process. Now this body is further divided into four segments: 1, 2, 3, and 4. Now coming to age of appearance of ossification centers of a sternum. Age of appearance of ossification centers. So remember it like this. It's in the sort of a table. 5, 5, 7, 7, 10. All this is in months intrauterine life. So 5 months intrauterine life, you get 2 segments which appear. Then ossification centers for second segment and third segment of body at 7 months intrauterine life. And 10 months intrauterine life or at birth, you get the fourth segment. And this xiphoid appears at about 3 years after birth. Rest all appear during intrauterine life. Now, how do they fuse? They fuse from bottom to top in 2 waves. First, there is a wave of fusion. This is the first wave of fusion. For body segments. And how do they fuse? Between 14 to 25 years. So to make it simple, you can remember like this: 15 years, 20 years, and 25 years from bottom to top. So this is the first wave of fusion for body segments. Then comes the second wave of fusion. And that second wave is for the segments which have not fused. That is your xiphoid and body segment and your manubrium and body. So xiphoid and body fuses at about 40 years of age. That was the question, 40 to 45 years. And this fuses in very old age, 60 years of life. Manubrium and body fuses between at about 60 years of age. Correct? So remember the age of appearance, and this side we have covered age of fusion. And this is the second wave of fusion. I can say second wave of fusion of ossification centers. First wave was for body segments. Second wave is for xiphoid and body, and then manubrium and body. So that's all for today. Keep on revising your notes. Keep your spirits high. This is the time when you will get that feeling that you are the worst, you have got the worst preparation. But believe me, if you keep on revising, with a confident heart, you will come out from your exam hall smiling. So remain confident. This is the time to keep your confidence on the rise. Don't feel low. And keep on revising. Keep on revising. Instead of reading something new, keep on revising what you have already read, so that you minimize your silly mistakes. Your boundary is 150, remember. Your boundary is 150. So how you have to achieve it, you know it better than anyone else. So keep on revising with a confident approach. You will succeed in your life. Thank you everyone. So stay safe, stay healthy. Chalo, bye bye. Bye bye. And if there is any query, you are free to ask your queries in the Telegram group, in my own group, or in the Unacademy NEET PG Telegram group.